My name is Khusbu Patel, and I'll be your student nurse today. And we'll be doing a head-to-toe assessment on you, and I'll give you some privacy. And now I'm going to need your name and birthday.
My name is Khusbu Patel, and my birthday is March 7, 2003.
Okay, now I'm going to check your wristband just to make sure. Okay, and I have all my tools here, and I have my note card in my pocket. And now we're going to start off with your head. So your head is normocephalic and erect, and now I'm going to palpate it. Let me know if there's any tenderness.
No.
Okay, so the head is non-tender upon palpation, and there are no lesions present. And now we're going to inspect your facial movement. So I'm going to need you to shut your eyes and wrinkle your forehead. Okay, and now I'm going to need you to clench your teeth. Okay, puff your cheeks, and now smile. Okay, good. That means your cranial nerves 5 and 7 are intact, and your movement was symmetric and smooth. And now I'm going to need you to close your eyes and extend your hand out, and I'm going to give you something to taste, and you tell me what it tastes like.
It tastes sweet.
Okay, good. So that means your cranial nerve number 7 is intact, and now I'm going to palpate your frontal sinus. Is there any tenderness?
No.
Okay, your maxillary?
No.
All right, so both the sinuses were non-tender upon palpation, and now we're going to move on to the eyes. So now if you could look down for me. Okay, look up for me. Okay, good. So your sclera is white with no discharge or crusting, and your conjunctival is pink bilaterally. And now we're going to do the diagnostics positions test, so I'm going to need you to follow my fingers. Okay, so your cranial nerves 3, 4, and 6 are intact with no nystagmus present bilaterally. And now we're going to check for your pupil size. Okay, so your pupils are 6 millimeters bilaterally. Now I'm going to need you to stare straight ahead. Okay, so your pupils constricted bilaterally, and I'm going to need you to stare over my shoulder at the wall behind me and focus on the pin light right here. Okay, so your pupils are round, equal, reactive to light, and accommodation, and that tested for cranial nerves 2 and 3, and they're also intact bilaterally. And now I'm going to test for the red reflex. So look straight ahead. Okay, so the red reflex was present and symmetric bilaterally, and now we're going to move on to the ears. So your ears are equal in size, and I'm going to palpate them and let me know if there's any tenderness.
No.
Okay, and they are non-tender upon palpation. And now we're going to do the whisper test. So I'm going to say 3 words to you, and you're going to tell me what they are. So before we do that, I'm going to need you to cover your left ear with your left hand. Okay, can you tell me what I said?
1, 2, 3.
Okay, and now cover your right ear with your right hand. Okay, can you tell me what I said?
5, 6, 7.
Okay, good. So your cranial nerve 8 is intact, and words were heard in both ears. And now we're going to do the Weber's test. I'm going to take a tuning fork and put it on top of your head, and you're going to let me know if you hear sound equally in both ears or more in one or the other.
Equally.
Okay, so sound is heard equally in both ears with no lateralization. And now I'm going to inspect the inside of your ear. Okay. So in the left ear, your tympanic membrane is intact. It is pearly gray and translucent. Your canals are patent, and the cone of light is at 7 o'clock. Now same thing for the other ear. Alright, so your tympanic membrane is intact. It is pearly gray and translucent. Your canals are patent, and the cone of light is shown at 5 o'clock. Okay, and now we're going to move on to the nose. So your nose is midline with no swelling present, and I'm going to need you to occlude one nostril and sniff up. Okay, now occlude the other nostril and sniff up. Okay, good. So that means your canals are patent bilaterally, And now I'm going to need you to close your eyes, occlude one nostril, and sniff up and tell me what this is.
A peppermint.
Okay, occlude the other nostril and sniff up and tell me what it is.
A peppermint.
Okay, good. So that means your cranial nerve 1 is intact and you are able to identify that it was a peppermint. And now I'm going to inspect the inside of your mouth, so if you could just open up for me. Okay, so your hard and soft palate is pink and moist. Your buccal mucosa is also pink and moist. Your uvula is midline and it is pink. Your tonsils are graded at a 2+. Your tongue is pink and rough, and your frenulum is intact, and it is centered underneath your tongue. And your posterior pharynx is pink and moist, and your dentition is all your teeth are present and they are intact with no signs of dental caries. And now I'm going to assess your tongue movement, so if you could say light, tight, dynamite.
Light, tight, dynamite.
Okay, so that means your cranial nerve 12 is intact and your tongue movement is smooth and your speech was clear. And now I'm going to need you to open up and say ah.
Ah.
Okay, so when you said ah, it tested for your gag reflex and your cranial nerves 9 and 10 are intact. And when you said ah, your uvula also rose midline and it also rose symmetrically. Okay, so now if you could stick out your tongue for me. Okay, good. So that means your cranial nerve 12 is intact and your tongue moves symmetrically. And now if you could swallow for me. Okay, so there are no impairments in swallowing. And now I'm going to look at your trachea. So your trachea is midline and symmetric. And now I'm going to palpate it. Let me know if there's any tenderness.
No.
Okay, so trachea upon palpation was non-tender. And now I'm going to palpate all your lymph nodes and tell me if there's any tenderness. So that's preauricular, posterior auricular, occipital, submental, submandibular, jugular-digastric, superficial cervical, deep cervical, posterior cervical, and supraclavicular. Did you feel tenderness anywhere?
No.
Okay, good. So your lymph nodes were non-palpable and there was no tenderness present. And now we're going to move on to the carotid. Okay, so your carotids are graded 2+ bilaterally. And now I'm going to auscultate them. So if you can take a deep breath in and out and hold it for me while I listen. Okay, and there are no bruits present bilaterally. And now I'm going to look at my note card real quick. Okay, so the next we're going to look at the skin. So your skin color is consistent throughout the body and with your genetic background, and there are no lesions present. And now I'm going to palpate for temperature. Okay, so your skin is warm and it is dry with no moisture, and your temperature is consistent throughout. Now I'm going to test for the turgor. Okay, so there is no tensing present and your skin recoils almost immediately. And now we're going to move on to the chest, so if you could turn sideways for me. Okay, and your AP to transverse ratio is 1:2. I'm going to lift up your shirt and check for your posterior respiratory expansion. So take a deep breath in. Okay, so your posterior respiratory expansion was symmetrical, and you can turn around now, and your breathing is unlabored, it is regular, and there are no accessory muscles being used. And now I'm going to auscultate for your lung sounds. So if you could just breathe in and out through your mouth. Okay, now turn around sideways for me. turn around now. So lung sounds were heard clearly, anteriorly and posteriorly, with no adventitious sounds. And now I'm going to auscultate for your heart sounds. So just look at that. We're going to start off with the aortic, which is at the second right interspace. The pulmonic, which is at the second left interspace. Okay, the tricuspid, which is at the left lower sternal border. And then the mitral, which is at the fifth left interspace at or around the midclavicular line. Okay, good. So S1 and S2 were heard with no murmurs. Now I'm going to assess for your pulses. So stick out your hands for me like this. Okay. Okay, so your brachial and your radial pulses were both graded 2+ bilaterally, and now your dorsalis pedis and your posterior tibialis. Okay, both of these pulses were also graded at 2+ bilaterally, and all of your pulses were in your upper and lower extremities were graded at 2+ bilaterally. And now I'm going to check for your capillary refill, so let me get your hands. Okay. Okay, so your capillary refill is less than 2 seconds in the upper and lower extremities. And now I'm going to need you to lay back down and lift up your shirt. And so now I'm going to inspect your abdomen. So your abdomen is flat with no lesions, and it is smooth with intact skin. And now I'm going to auscultate it, starting at the right lower quadrant. Okay, so bowel sounds were heard in all 4 quadrants, and now I'm going to percuss. Okay, so when I percussed, tympani was heard in all 4 quadrants, and now I'm going to do a light palpation. So let me know if you feel any tenderness.
No.
Okay. All right, and now we're going to do deep palpation. So let me know if you also feel any tenderness.
No.
Okay. You can get back up. And so there was no tenderness present, and there were no masses or lumps detected as well. And now we're going to do the range of motion of the neck. So I'm going to need you to flex down, extend back up, do lateral bending of the right, lateral bending left. One more time. Okay, rotate left, rotate right. Okay, so there is full range of motion in the neck. And now I'm going to use your arms. So flex and extend. Okay, pronate and supinate. Okay, now same thing with the other hand. Okay, pronate, supinate. And there is full range of motion in the arms bilaterally. And now I'm going to need you to stand up and do flexion and extension of the knee. Flex, extend, same thing. Okay, so your range of motion is equal bilaterally in your knees. And now I'm going to need you to flex down to check for your spine. Okay, come back up. And now I'm going to need you to do lateral bending to the left, lateral bending to the right. Okay, rotate left, rotate right. Okay, so there is full range of motion in the spine, and altogether there is full range of motion bilaterally in all extremities. And now you can sit down now. Okay, and so now I'm going to check for your muscle strength, so just push up against my hands. Okay, the other way. Grab my hands. Okay, grab my thumbs. Okay, so your muscle strength in your hands is graded at 5+ bilaterally. Now I'm going to check your feet, so push up against me. Okay, the other way. All right, so muscle strength in your legs was graded 5+ bilaterally and both extremities. And now we're going to do a shoulder shrug. So Good job. Okay. So that means your cranial nerve 11 is intact and your muscle strength is 5+ bilaterally. And now we're going to do the last part of our assessment, which is a neurologic. And so we're going to do a cerebellar test. So if you could just stand up for me and put your feet together and your arms to the side and close your eyes. Okay, good. So that means you had a negative Romberg test and you were able to maintain posture and even balance. And now we're going to do tandem walking, and let's just walk right here and do heel to toe all the way down slowly. Okay, now turn back around. Okay, good. So you walked in a straight line and stayed balanced. So that means your cerebellar function is intact and that you can sit down now. Now we're going to test for your coordination. So I'm going to need you to extend your hands out like this, close your eyes, and take your right hand, the pointer finger, and touch your nose. And now your left pointer finger, and keep going as fast as you can. All right, good. You can stop now. So that means your coordination is intact and you are able to do this with smooth and accurate movements. And now we're going to move on to the sensory test. And so I'm going to break this tongue blade in half, and I'm going to need you to close your eyes and tell me where you feel a sharp sensation or a dull. So.
That's sharp.
Okay.
Dull. Sharp. Dull.
Okay.
Dull. Sharp. Dull. Sharp. Dull. Sharp. 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 Dull. Dull.
Okay, so you were able to feel pain and you were able to distinguish that it is sharp or dull bilaterally. And now we're going to move on to the last test. So I'm going to need you to close your eyes and hold out your left hand and tell me what this object is.
A Q-tip.
Okay, and now hold out your other hand and tell me what this object is.
A rubber band.
Okay, and that tested for its diagnosis, and there is no sensory impairment bilaterally. Now I'm going to check my note card and see if we missed anything. Okay, we did not miss anything, and that concludes our assessment. Thank you for your time.